First of all, thank you so much for the invitation to speak at this event. And my greetings to all other participants. My name is Nino Pagalesia, and I am a Venezuelan Canadian in Vancouver, Canada. I am a longtime Cuba Solidarity activist and writer. The global pandemic caused by the COVID-19 since the beginning of this year is a major tragedy of great proportions that reveals the vulnerability of societies when they are not prepared for such occurrences, or when they choose to disregard the urgent priority that is required in order to save lives instead of saving the economy. Some political analysts have suggested that the impact of the pandemic is being handled more successfully by those countries that have a socialist system like Cuba, Venezuela, and Nicaragua, despite the U.S. sanctions and blockades in those countries. Whereas capitalist countries like the U.S. and Brazil, for instance, have failed in containing the number of positive cases and deaths by the COVID-19. I personally agree that there is a relationship between well-planned socialist policies and the positive outcomes for the population, particularly as it applies to public health. I would like to speak about what I believe is an important factor to achieve good population health, or at least to minimize adverse effects. I will do so by referring more specifically to Socialist Cuba for its outstanding success, not only in containing the pandemic in the country, but also for contributing resources and expertise in international health through its renowned medical missions. In my professional career as a researcher at the University of British Columbia in Canada, I had the privilege of being involved in projects in collaboration with Cuban colleagues looking at the Cuban healthcare system, public health, and international health. I learned a lot from that experience. I learned, for instance, how seriously and how far Cuba takes the notion of prevention in public health with a strong health knowledge component, so the population is empowered and becomes an active participant in their own well-being. Cuba has fully incorporated social determinants of health in public health policies. Those are factors such as income, education and literacy, employment, working conditions, social and physical environments, health lifestyles, etc., that determine the health status of individuals. All of these factors are managed by a well-organized society that has solid intersectoral links that work in cooperation and not in competition. But over time, I have also learned that Cuba has incorporated what I consider another determinant of health that I believe has contributed to its impressive success in healthcare. This is the notion of solidarity. Both governments and organizations have made numerous attempts since the last quarter of the 20th century to achieve the ambitious goal of health for all. However, despite commitments to the ethical concepts of equity, solidarity, and social justice, good population health, and equal access to healthcare remain elusive today in most countries. Cuba is one of a handful of exceptions in the world. Cuba has had a long tradition of solidarity following the victory of the Cuban Revolution in 1959. As early as 1960, Ernesto Che Guevara addressed a group of graduating physicians and told them, and I paraphrase, "All we have been doing is charity. What we need to do is solidarity for the well-being of the people." Today, Cuba exemplifies the practice of solidarity in two main areas. One, in providing social assistance to its citizens, and two, in contributing to global health or international health. Cuba has practiced solidarity in the form of state support for its citizens through social services programs. Solidarity is embedded in Article 1 of the Cuban Constitution, and I quote, "Cuba is a socialist state organized with everyone and for the good of all," end quote. Solidarity is mentioned again in other articles as a right, but also as a duty towards others, as a human principle. At the same time, Article 72 of the Constitution states, and I quote again, "Public health is a right of all people, and it is the responsibility of the state to guarantee access, gratuity, and the quality of care services, protection, and recovery," end quote. These two articles definitely link solidarity and health as people's constitutional rights. I am convinced that the notion of solidarity plays a key role in Cuba's outstanding health outcomes. We see the practical results in one of the lowest infant mortality rates, the achievement of the Millennium Development Goals established by the World Health Organization, and the recognition also by the World Health Organization of Cuba as the first country in the world to eliminate mother-to-child transmission of HIV and syphilis. Cuba also practices solidarity in the area of international health with the same commitment and dedication as domestically. We have all been witnesses to Cuban medical missions in the world, helping even in advanced countries like Italy. Now, in policy terms, the association between solidarity and healthcare has been recognized both by the Pan American Health Organization and the World Health Organization. Of the 21 policy targets identified by the World Health Organization for the 21st century, the very first health target for the European region is solidarity for health. Now, Cuba preceded the recommendation suggested by the Pan American Health Organization. It is well known that Cuba's first international medical team was sent to Chile in 1960 following a disastrous earthquake, while one of the more dramatic examples was in 2015, helping fight Ebola in the West Africa. And as I mentioned, Cuba's mission to Italy and elsewhere this year. Cuba has had up to 50,000 health workers posted in 68 countries. 15 medical brigades with almost 600 health professionals have been dispatched specifically to help fight the COVID-19 virus. Now, with this summarized account of Cuba's success in population health, we can safely conclude that Cubans seem to have captured the importance of solidarity and cultivated it as a social value. In a telling statement of Honduran medical student from the Latin American School of Medicine in Cuba said, "We are being trained in the practice and principles of solidarity." This is precisely what Che suggested in 1960, predating all the recommendations by international experts on how to achieve health for all. So finally, when we remember Che's call for solidarity, and 50, 60 years later, we hear that healthcare professionals in Cuba are trained in solidarity. When we observe Cuba sending medical missions from the first one in 1960 to this day to other countries to fight the COVID-19 pandemic, when we note that the healthcare indicators in Cuba are getting better over the last 60 years, and when Cuba announces biological advances in the development of medications to fight chronic diseases and vaccines, then we notice that Cuba practices what it preaches. We notice a consistency between action and discourse by Cuban policymakers. That is the government's political will that all Cubans can count on, because the government is truly their government and no one else's. In a larger context, we can say that political will is the strongest tool that sustains Cuba's sovereignty and independence. Cuba's political will is the determination to maintain its socialist path, because it is a proven path towards the well-being of all Cubans and other many countries outside Cuba. But this is a bad example for the U.S. empire. As we know, for that reason, the U.S. government has been obsessed with breaking Cuba's political will with a criminal blockade. 12 presidents later, today Cuba remains socialist and free. But our work in solidarity with Cuba is not over. The 13th U.S. president will continue, most likely, harassing Cuba, and we have to be prepared to condemn the U.S. government and defend Cuba against its aggression. Thank you.